Hi everyone, this is Dr. Sharayu and welcome to my YouTube channel. Today I'll tell you about anemia. Anemia is defined as reduction in the level of hemoglobin. The normal level of hemoglobin in a female is 11.5 to 13.5 gram percent. In a male, it is 13 to 16 gram percent. Hemoglobin is a protein which carries oxygen. Thus, reduction in the level of hemoglobin reduces oxygen levels. The symptoms of anemia are tiredness, lightheadedness, breathlessness, fatigue. All this is a result of reduction in the oxygen level. The signs of anemia are pallor, that is paleness of mucous membrane, skin, conjunctiva, buccal cavity, tongue, palms and nails. All these appear pale. Also, there is ankle edema, that is swelling of the ankle joints. There is increase in the respiratory rate and decrease in the blood pressure. Hair fall is another associated complaint of anemia. Now, the causes of anemia, I will be discussing the most important and most common causes. Acid peptic diseases, that is peptic ulcers, duodenal ulcers, hemorrhoids, fissures and fistula. All these causes perrectal bleeding, that is blood in the stools. This can be frank blood or occult blood, which means it can be fresh blood or the stools can be black colored. Over a period of time, it is going to definitely cause anemia. Next is hookworm infection. Hookworm infection is a parasitic infection where this parasite resides in your intestine and perforates the intestine. It causes bleeding in stools, again which is going to cause anemia. It is because of poor hygiene or lack of awareness about personal hygiene and cleanliness. Next is chronic hematuria or presence of blood in urine. It is seen in cancers as well as CKD patients. And next is excessive menstrual periods or excessive menstrual bleeding, which is going to cause anemia. So before we move on to the preventive aspect, please go ahead and hit the subscribe button and also hit the bell icon next to it so that whenever I make a new video, you're automatically notified. I'm Dr. Sharayu, providing consultancy in Mumbai and Pune. I'm owner and prime consultant at Dr. Sharayu's Homeocare. I'm diet, fitness and homeopathic consultant. So hit the subscribe button and we'll move on with the video. Now we move on to the prevention. First and the most important is your diet aspect. Eating iron-rich food. Green leafy vegetables, dry fruits like dates, black raisins, all the red and orange fruits, pomegranates, beetroot and meat. It's very important to eat all of this in order to keep your iron stores at a high level. B12 is very important because deficiency of B12 is going to cause megaloblastic anemia. B12 sources are only animal sources. So, all the dairy products is going to be the only source of B12. Next is iron and folic acid tablets which are available in the market. Ferrous sulfate, ferrous fumarate and gluconate. All these are available in the market which you can easily take. Next is get treated for the above cause which I had earlier mentioned. That is very important because that is going to cause a heavy blood loss over a period of time and that is definitely going to cause anemia. So getting the correct treatment for these causes is very important. Fourth and the most important is homeopathic approach. Homeopathy is very important from the prevention as well as treatment point of view. Now for prevention, I'd like to mention a few cases. There are patients whose hemoglobins have never risen above 10 and 12, especially girls of puberty age who have never been better since then. There are people, those who have history of viral diseases, of liver complaints, and since then their hemoglobins are not rising that much, or in spite of eating a lot of iron tablets, in spite of that there is no good assimilation of iron, there is no correct absorption of iron, and in all these cases homeopathy reigns supreme. So homeopathy is very important from prevention point of view as well, and this is definitely new to all of you, and this is a totally new approach, and it is proactive homeopathy, and that is the correct way which is going to guide most of the people towards achieving a good amount of hemoglobin in your body. Thank you everybody for listening to me, and hit the like button, invite your friends so that they also can subscribe to my channel, and have a good day, have a healthy life ahead. Thank you.